Welcome to Bacchus Health Beat, your source for health news and information. I'm Sean Mahaney, Director of Communications and Community Relations at Bacchus, and March 3rd through 9th is National Patient Safety Awareness Week. We're pleased to present 3 short videos on the topic of safety. Join me and Dr. Peter Shea, Senior Vice President and Chief Medical Officer, as we start by talking about the basics, what safety means, and how simple things like washing your hands is important. Thank you very much, Dr. Shea, for joining us today.
Well, thank you for asking me, Sean.
We really appreciate it, and it's a very opportune time to have you. We're at March 3rd through 9th is National Patient Safety Awareness Week, and I think a real basic question that we could ask you is, really what is patient safety, and what does it mean to the community?
Well, I think patient safety goes back to ancient times in reality. I mean, one of the basic principles in medicine is, above all, do no harm. Our goal is to heal patients without harming them. And when you think about this topic, it always seems contradictory. Why would we harm patients when we're trying to heal them? But the fact is that the field of medicine, the practice within healthcare, is complex, and we do high-risk things for patients. And in that environment, we run the risk of harming people in our attempt to heal them.
Well, I think it would be I think people would be surprised to even think of the word harm in association with the hospital, and tend to think that they can leave, sit back and leave everything in the hands of their providers, when in reality a large piece of patient safety, obviously clinicians play a big role in that, but patients do as well.
Right, and it's not just about the high-level technology that we look at. We hear these high-profile cases about patients receiving overdoses of chemotherapy or mismatched organs and organ transplant, but it's a lot of simple things day-to-day that patients can do to contribute to safe care. I think just simple hygiene issues, using accurate communication skills with their practitioners to keep track of your medications. Speak out when you're in the healthcare setting. If you don't think something's right, say something. If somebody wants to give you medicine and you think you might be allergic, speak out. I think patients have a very important role, and it's all about good communication.
Dr. Shea, you had mentioned that it's not always about the latest technology or high-tech surgery. I mean, sometimes patient safety can be as simple as washing your hands, and that can be washing your hands at home, but in the hospital as well. I mean, I know that that our clinicians, nurses, physicians, and others that are entering patients' rooms, they're required to wash their hands, I believe, when they go into the room and when they leave the room. What else? I mean, why is hand washing so important? It sounds like such a basic thing.
Well, in hospitals, we're always confronted with the issue of hospital-acquired infections, and sometimes the nature of the bacteria that are in a hospital are a little more dangerous than what you might be exposed to in the outpatient area. And the simple act of washing your hands before you have contact with a patient and after you have contact with a patient reduces infections significantly. Very simple, very basic, and it would also go for the patients themselves when they interact with visitors or hospital staff as well.